A comprehensive lung program is not just about lung cancer, though that is a big part of our push right now. A comprehensive lung program really looks at the tremendous burden of respiratory disease within our community. The number of patients in our community who have pulmonary fibrosis or severe asthma or sarcoidosis is particularly prevalent within this community. Addressing all of these diseases in a more comprehensive way is really important. That runs the gamut from our program with lung cancer to our program for lung volume reduction with Zephyr valves, to the sleep lab, to our intensive care unit services here at Silver Cross. Really, addressing all of those things is about addressing our community better and addressing their health.
My name is Paula Holcomb. I had the ion procedure at Silver Cross Hospital last November. I'm originally from New Lenox. My husband and I raised our children, 2 sons, in Manhattan. We moved to McLeansboro in 2013. My story began in 2018. I went for my annual physical and mentioned to my primary that I had not had a chest x-ray in a long time. So he sent me for one, and it showed an abnormality. I had recently read an article in the Joliet Herald News Online that Dr. McDonough does what's called an ion procedure, and I knew that was exactly what I wanted to have done.
My initial reaction was, surely somebody closer to her could take care of her. And so I reached out to some colleagues in St. Louis because she's, about an hour southeast of St. Louis, and nobody was really doing this procedure down in St. Louis. The most important thing for her was to get her diagnosed and to evaluate her. And so we 100% tried to make that happen.
Any diagnosis of lung cancer can be very terrifying to a patient and their family members. As a lung nurse navigator, I interact with all patients from the primary care team all the way up into patients who are diagnosed with lung cancer. Mainly my interactions are with patients coming in for lung cancer screening, and that is a low-dose lung CT scan. But it places a big burden on the family and the patient once they get that diagnosis, and I'm just there to help navigate to the next steps in care. If a patient were to come in for a scan, or if they had a nodule incidentally found on another diagnostic procedure, then I would be involved and I would be like, well, let's take your case to our multidisciplinary lung conference.
Every week we meet with the University of Chicago Oncology as well as radiation oncology and our pulmonary colleagues at Multidisciplinary Tumor Board, where we discuss particularly difficult cases in lung cancer care. Patients get the ability to have multiple opinions in one setting to come up with a consensus of the best care for patients.
Because of this tremendous cancer burden, it's really important for us to find people early and try to identify them during a time when we can cure them of their disease and not just treat them or give them salvage therapy. Those patients are really candidates for what we call low-dose CT screening, in an effort to try and identify early cancer patients.
Rush has a long-standing history in lung cancer care in the Chicagoland area, dating back to the 1950s. Being able to come out to a community setting like Silver Cross, we're able to sort of bring those ideas, those values of how we've managed lung cancer patients and some of our programs that we've developed out at downtown at Rush, and really bring them and integrate them into the Silver Cross system.
On October 20th, 2022, Dr. McDonough gave me a call and we talked at length with my husband too. And we set up the ion, and within a month, I was heading up north, the 5-hour drive, to have my ion procedure done.
The ion robot allows us to get into areas of the lung that were previously inaccessible to us, or were only accessible by very high-risk procedures. In the past, our technology allowed us to go after somewhat larger nodules, somewhat closer to the center of the chest, and even then only acquire a diagnosis in about 60 or 70% of the cases. Now we can go through the lungs and we can biopsy these very small things that are sometimes the size of 1/3 of an inch, and do so with diagnostic accuracy that exceeds 90% and with complication rates that are less than 1%. And so that's really exciting for us. A lot of the patients who we are diagnosing now with the ion robot would have had to wait before. and we would have had to wait till their cancer grew substantially before we could biopsy it, or they would have to go through a biopsy that had a much higher risk of complication. The ION has closed the doors on those complications, but opened the doors for diagnosis.
I knew when I called Dr. McDonough's office up north that I was in for some traveling. But to me, going to Silver Cross, where I knew and trusted, was well worth the trip. When I was waiting in the recovery room after the ION, I thought, well, are we going to know? Is this going to tell me? And when they wheeled me back into the room, the look on my husband's face, I knew it wasn't good. But I knew that we were going to take care of this, and I had good doctors, and I would be okay. Scared, yes, but I would be okay.
When a patient is very, fearful, I always try and listen to them and try and understand from where they're coming from, because not every patient's the same, not every diagnosis is the same. So understanding, their needs financially, emotionally, spiritually, so that they get the right care that they need.
The process of going through evaluation, screening, biopsy, and ultimately treatment requires so many people pulling in the same direction. And for Paula, that really was magnified. And so just to sort of illustrate that, it took the team from our office to get her scheduled. It took a CT tech processing her and getting her CAT scan ready for us so that she could come to the lab. And then ultimately, a respiratory therapist who agreed to work over her lunch hour to do her pulmonary function test so that Paula didn't have to drive back 4 hours on some other day to get her PFT. That's exceptional in the sense that we did it all in one day, but it's not exceptional here at Silver Cross. It is important to me to really give credit to all of the people that I work with, because all of these people are doing this every day. Paula's one of now almost 200 patients that have been through this process. And each one of these people who I'm highlighting right now has had their hand in all of those 200 cases and for the 200 to come.
This community has a very high rate of lung cancer. We make up almost 10% of lung cancer cases in this county out of the whole state of Illinois. Proportionally, it's a higher rate than Cook County. So having a comprehensive lung cancer program, we can actually really bring something that is truly needed in this area.
Paula's story is one of success. It is a case example of how we want our patients to be treated. She had a lung nodule that was identified. She came here on a single day and got diagnostic procedures that proved the fact that she had cancer. In less than a month, she came back a second time. She had a surgery with a resection of her tumor that showed clean margins and no further cancer. And a couple of days after her surgery, she drove back to her hometown, free of cancer, breathing well, and with a plan to live the rest of her life cancer-free.
As of right now, I'm cancer-free. I owe it to the expertise of the doctors that I had at Silver Cross for how I feel today.